Hello. During this video presentation, I will be covering the psychodrama type of therapy. My name is Christopher Capobianco, and this is part of the class HMS 107. The main components of the psychodrama theory is much like directing a play or a movie. It involves a group director, that's going to be the facilitator, the main actor, and the audience, as you would in any play. Psychodrama is a type of therapy that lets the client act out and role play different situations that patients have regretted or valued to be significant to them. This type of therapy is a way for clients to express their thoughts and feelings in a more elaborate and dramatic way. Much research has shown that role playing in a group setting is very beneficial to the patients. It's going to make it happen and reenact the situations in a more authentic and realistic way than other types of therapy of just sitting and talking to each other about their situation. Many group members will be able to give insight on how they reacted, and they're also going to be able to have a real life example in great detail of the situation. The reason why psychodrama is going to allow members to have a more authentic and realistic explanation of the situation is that they're going to have it in a first person basis. When you're able to reenact something and show them and tell them, these were my thoughts, these were my feelings, this is what the person was doing. It will really allow members to have their own thoughts and their own feelings, and will be able to relate in a more deep and thoughtful manner. And this will lead to deeper and more shared feelings, because you're going to be able to relate to why somebody did something, why they reacted in a certain manner. The types of groups that psychodrama therapy will serve is a certain particular person. They need to be able to be comfortable sharing in a dramatic fashion. Psychodrama, drama, just like you're doing a play or role playing. That's exactly what it is. It is a type of role playing. So they should be comfortable in front of others to express their feelings. And as Marino stated in the 1930s, this therapy will give participants a sharper focus on themselves by choosing different ways to play out their roles. So when they're able to express themselves, that's going to give them better insight of the client of how they reacted, why they reacted. Was it a acceptable way to react to that situation? There's so many things that go into somebody's reaction to any situation or problem that they feel significant to them. And so by them being able to relay that and express that with all their emotions, with all their thoughts, with all their feelings, it's going to have a deeper insight. And that's why this type of therapy they need to be comfortable with other people and being able to express themselves in a much more authentic and deeper way. So the therapeutic time frame of the psychodrama, in much research that we have that I have done, it shows that each session needs to be at least 2 or more hours. That's minimum. Now that might seem a lot, but when you are actively engaging and going through each role to a certain group of patients that are expressing themselves, there is a lot more detail, a lot more thoughts, a lot more deeper expression of their feelings. So it takes a little while. I mean, 2.5 hours is a long time. Sometimes it goes to 3. So, there's they need an ample amount of time, because once you're done with the session and everybody, whoever's gone at that point, you need to close, and you always want to have a good closure, just like I would do in a class that I teach. You want to have a closure of what we went through, what did we learn, what happened, why did we react a certain way, what do we learn from this, how do we improve? So by having a group of other participants there, they can give their insight on how that person did. And if they're ever brought back to a situation similar to it, how did they improve? What did they do differently to improve their behaviors, of how they acted in a situation to better themselves? So the guidelines that involve in the psychodrama type of therapy is mainly the protagonist is the director, and they're going to lead and explore and define what everyone and how everyone should be acting. There's 3 basic phases to it. There's the warm up, the action, and the share and discussion. When you're warming up, you know, you want everyone to feel comfortable and who's willing to share and how to share appropriately. They need to define all of these roles to make it clear of what's acceptable, what's not acceptable. The action is going to be just like a movie. When you see someone say action, they're going to express and dramatically role play and reenact the situation that they feel is significant to them and something that they want to improve on. Finally, the sharing and discussing. This is where the groundbreaking will happen for the patients. Sharing, discussing, and talking about and getting other input from other patients is key to the 3 basic phases. So auxiliary egos, they're supporting players, other patients that can be part of the role playing. They can play the person who the patient wants to say the situation was about. They can play significant roles. They can play background roles. They say somebody that might have had a significant impact. So, for example, if a situation happened in the grocery store, someplace public, you can have a group of people who might have seen a situation and that's why they reacted a certain way because of a look they were given, those kinds of things. It can go down to very, very minute details, which is great about this. And, they play the key role in the audience. Catharsis is when they're rediscovering buried emotions that can lead to insight. It's going to be an increased awareness of problems that they had in a certain situation, and it can be a come to moment when they realize, oh, this is why I'm reacting. This is why I think a certain way, because the way that I was raised, or the way that my culture is, or the way the values of my family. And that can have a lot of breakthrough for many patients. So there are many different types of strategies that the psychodrama therapy uses. Role reversal, to me, is the most powerful tool because it involves somebody portraying somebody else, a patient, a group member, portraying their role. So the patient who has a struggle or a situation that they want to cover, another person will reenact as close as they can to how that patient reacted to the situation. And this will give insight on how did I overreact? Was I right? Was I wrong? Should I do this next time? Should I, maybe take 10 seconds and think about it before I react? That can have groundbreaking insight for the patient. So this is something that can really, really help a patient. The double is another type of strategy, plays a special role and contributes to the thoughts and feelings that are not expressed. And, this really falls on the protagonist. They'll say words that were not being said, mainly body language, what you thought somebody was thinking, what they might have been thinking. You could think that somebody's upset with you and they're really not. They're just confused. Everybody's reactions and interpretations to the situation. So another strategy of the psychodrama therapy is the empty chair. And the empty chair involves when somebody is deceased or is not present anymore. So if you had a regrettable situation with mostly elderly, a parent, a grandparent that you might regret, that you wish you could take back, and sometimes the role plays, the audience will, use the double or role reversal and maybe act as the deceased person that they're struggling to move forward with, and it can be more realistic for the individual when they role play. So the main application for the psychodrama type of therapy, this is type of therapy will be used in mental health programs, schools, and businesses. I can relate with the schools. As being a school teacher, it's some strategy that I use all the time when a student or multiple students come up to me and say, a person did so and so. Okay, somebody's bullying me. So when I hear that, I usually go up to the student and I say, okay, well, what happened? I didn't bully them. I didn't do anything. Okay, let's reenact it. Show me exactly what you did. How did you react to the person? And they will react and they'll go through the whole thing. And sometimes they're taken off by, off guard because they're like, wow, we're actually reenacting it. And sometimes that can be a moment where they're saying, you know what? I understand why they thought I might have been rude or was bullying them. And it gives them insight on, okay, so this is how I was acting. How can I do better? What can I do differently to improve my status and my behavior of how somebody else is interpreting it? All of this therapy is all about interpretations, how somebody thinks you're reacting, how someone thinks you're acting, how someone will interpret something, all depends on the person. And your mannerisms, your body language, your demeanor is all about interpretation. So trying to be clear, focus, having a positive face, positive demeanor about yourself as best you can will also help with them being more approachable and explaining themselves. So it's something that we use many, many times, all the time in school, and it's very successful. And I'm glad that I'm able to put a name to the type of technique that we use now. So as far as the diversity perspective, there's plenty of research, sufficient research that indicates that this therapy will work with different cultures. As long as you have someone of a similar culture, it's going to make the process a lot easier, but you also have to understand in a workplace there's going to be, or any place, public place, there's going to be many, many cultures. So being able to respect and alter your behavior and understand what might be sensitive, what might not be sensitive to certain groups is just being more mindful of others. So this strategy is very beneficial to all types of groups. And, as a clinical therapist, when you're doing this type of strategy, you're going to work with all types of people, all types of cultures. So it's important for you to be able to be adaptive and learn and understanding what the trigger points are for certain cultures, certain people, and all that. So being able to work on trial basis can be beneficial to opening and sharing different cultures' deeper and most inner thoughts. This can be very, very successful, but to have the buy-in from everybody in the group will eventually determine the success. So you have to adapt. You have to make it work. That's your responsibility as the facilitator or director in the psychodrama type of therapy. So to wrap things up, the assessment practices, this type of therapy, in my opinion, will lead to more realistic conflict resolutions, and they're going to have a more direct experience for the other members and the members itself when they're able to see themselves when somebody else is role playing in the double, when they're able to see how they reacted and see how somebody else interpreted how they react. They might have think that they reacted fine and they weren't aggressive or they weren't out of line. And when you watch somebody else, you find out, you know what, I was out of line. That was wrong of me, and I need to make better decisions to move forward and progress in a positive manner. The other members will be able to demonstrate how they respond and provide with different ways to cope with a similar situation in the future, to eventually better themselves mentally, physically, spiritually. I mean, we want our patients to eventually be able to therapize themselves. I think that's a word. They need to be able to catch these things that they might say, okay, I do overreact. I do make somebody upset. My demeanor is not approachable. Being able to realize and see those things is really the first step, the positive step that they'll be able to do to build themselves and make themselves better. So I thought that this research of the psychodrama therapy was very insightful to me, realizing that I use a lot of this during the day without even knowing it. So I'm really glad that I picked this subject, and I think that this video will show the research and the applications that can be used is in the psychodrama type of therapy, and I'm very glad that I picked this, and it was a very good assignment, and something that I'll be able to use and relate with other students in my profession. Thank you, and have a good day.